So we're here at our 4th annual Glaucoma Patient Summit in Oak Brook, Illinois. Joining me is
Ben Grass. So I'm actually one of the token Canadians here, glaucoma patient after I was born with it, and recently got involved on the steering committee at the GRF and looking forward to the discussion.
Can you please tell us a little bit about yourself and how glaucoma has impacted your life?
Yeah, absolutely. So born and raised in Canada, definitely it was a bigger impact kind of beyond my memory as a child, right? Mm-hmm. Going through the motions would have been a lot more stressful on my parents. But growing up, a lot of trips back and forth to Boston to see my doctor, and I mean, it was always a little bit more challenging with glasses from a young age, and just making sure that was incorporated into my sports and my athletics. And then, I mean, now that really shaped what I wanted to do as a career. It was always around the medical profession. It was always around healthcare. And now working in kind of the software that empowers patient engagement in healthcare, definitely a lot of my inner passion for work comes from that background and that journey that I had as a kid and growing up.
Yeah. How old were you when you were diagnosed with glaucoma?
So when I was diagnosed, I was 4.5 months.
Wow.
So born with it, and it took that long to actually get it diagnosed.
Have your parents told you how they figured it out? Was it something they saw?
Yeah, there's quite a story behind that. And do we want to get into the full story, because it was quite a journey? It actually started even before I was born. On the initial ultrasound, my mom made the initial comment of, my eyes are very big, even at that point. And as the pregnancy progressed, she had high amniotic fluid, which is a big alarm bell of something's wrong. So looking at, is it a heart issue? Is it an organ issue? Where's the problem? And even in a more detailed ultrasound, they couldn't find anything. It all looked okay. But my mom was still pushing that my eyes looked big. And so after I was born, in delivery, they looked me over, again, still with that alarm bell of trying to find what's wrong, and they didn't find anything. And so when thinking about, doctors, nurses, all looked me over and missed it. And then, so in all of my regular follow-ups to my family physician, kind of those post-birth appointments, my mom continued to push that she thought that there was something wrong with my eyes. There was some redness in the tissue. I was photosensitive, so going outside, I was always squinty. And my family doctor continued to dismiss the claims. His eyes are fine. You don't need to worry about this. And it wasn't until about at 3.5 months when I had what they called some kind of an interrupted SIDS episode. It was like I was struggling to breathe, and that caused me to be rushed to the hospital as an infant. And then they did the full panel again, and there was a pediatrician, there was a neurologist, there was 5 doctors looked me over in that, trying to figure out what caused this episode, and they still missed everything. And so my mom, even in that visit, she was saying, like, look at his eyes. Please, just look at his eyes. And they said, no, like, eyes are fine. And I mean, these are specialists. And so again, after that visit, we were discharged back home, and we went back to the regular scheduled appointments with our family physician. And even then, the family physician was calling my mom an overreactive nurse, as she wouldn't take no for an answer, and she kept pushing, I need to see a specialist. Please get us into an eye specialist, because there's something wrong with his eyes. And after a few more appointments, it was finally accepted that, okay, I'll submit a referral. And in the Canadian healthcare system, things move a little bit slower. And so, okay, I'll submit a referral, you'll see a specialist, and everything will be fine. And then over a week went by, and my mom's calling in going, I haven't been called by the specialist office. And the receptionist said, oh, yeah, that's on my desk. I'm going to mail that off soon. You should get in somewhere in the next 6 months. And my mom was going like, no, you don't understand. My son has to see the specialist like way sooner than that. We can't wait 6 months. And so they said, okay, we'll call the office, we'll try to get him in a few weeks, we'll do the best that we can do. So then we had the follow-up appointment to that SIDS episode with the pediatrician. And basically, again, looked at my mom and said, why are you even bothering with the specialist appointment? You should cancel that. Like, don't bother with that. He's fine. And so, again, my mom said, no. Like, if you can call, you think I'm crazy, if you could call that specialist office and even move my appointment up a few more weeks, and if they tell me I'm crazy, I'll accept it. I'll never say a word about it again. I said, okay, I'll make the call. Made the call, got me in a few weeks earlier. And at this point, my pressures are up in the 40s, and we didn't even know this yet. So I'm an infant, and in help, and if it wasn't for my parents continuing to push this envelope, I don't even get to see a specialist. And so we went into the specialist's office. Again, we're a few weeks later, and they set me down in the chair in the device, and he didn't even have to touch me. He took one look at me and looked at my parents and said, Lynn, I'm sorry to tell you, your kid has glaucoma. Didn't even have to touch me, one look. And my parents were just like, how does this get missed when he can just take the slightest look at this? And so that was on a Tuesday. By Thursday, I was into the Children's Hospital in Halifax, and seeing the surgeon Thursday morning. Was having surgery, emergency surgery Thursday afternoon on my worst eye. And that specialist, the reason I'd seen him was because he had actually just come out of Boston doing his residency. So if there was any new technology, he was going to be the guy. I was his first patient, first surgery ever. So he's doing my worst eye on an emergency basis, way late in the process. I mean, I had 75% damage in one eye, 85% damage in the other. Like, it had gone a long way. And after the first surgery, he did the worst eye. He started to get optimistic. He did the second surgery on my good eye, or on my better eye, on the Saturday, and it went an hour and a half long. And he came out of that deflated and said, his messaging to my parents was, listen, there's a good blind school in Halifax. You should consider quitting your jobs and moving here. And it was, you can imagine the wave of emotions that comes with that, as they've been advocating this whole time, and to get that kind of news. So they asked the doctor, listen, if this was your son, what would you do? If you couldn't do surgery on your own kid, who would you want to go to? And he said, okay, listen, I did my residency in Boston. There's this guy, Dr. Walton. I can make a call, and that's what I would do. So absolutely, let's do that. That's the direction we have to go. So that's what got me in to see Dr. Walton in Boston. So it's 2 weeks later. We had drove down, and it was right before Dr. Walton was actually going on vacation. He had given away all his OR time. He wasn't coming in, and so he was trying to get us to come in. This was on another Thursday. Can you get on a plane right now and see me before vacation? Well, that wasn't possible. So we drove down to New York, stayed with friends, and he came in on the Monday to see us. And again, he knew that if this guy was calling him from Halifax, like, I was in trouble. And so when I got in to see him, again, took one look at me, looked me over, pressures are still insanely bad. And he's like, okay, I gave away my OR time, but I need to see him tomorrow morning, 8 a.m., emergency surgery, we're doing this again. And so he got the OR time, scheduled, 8 a.m., emergency surgery, skipped his vacation, but that's just the kind of guy this guy was. He's just, he's phenomenal. And did both eyes at the same time, and for the rest of that week, I was there until Thursday, and he wouldn't let anybody touch me. No, any drops, any checkups, it was only him. No nurse could touch me, and he was meticulous with his follow-up through that week. And so on Thursday, he said, okay, you take your kid. They had arranged for us to stay through like a patient support program in the network near Boston. So he's actually teaching that day, and we ended up coming in at like 11 p.m. because he's like, listen, I'll call you when I'm an hour out of the clinic, and I'll see Ben, and we'll make sure that he's good to go. And so he called my parents at 10:30 p.m. that Friday, said, okay, I'm gonna be there in an hour, like come meet me. So they went and met him, and he looked me over and he was so thrilled. They tried to apologize for bringing him in so late, and he said, are you kidding me? Like, this is the highlight of my day. I've been looking forward to this all day. And he looked me over, and my parents tried to pay him for that visit, and he said no. Like, he refused payment. He said, listen, go buy yourselves a bottle of champagne, because this was tremendously successful. Like, Lynn and John, take your son home. Like, this is good. We'll see him again in 2 weeks or 1 week. And he was even trying to pass us off that now we could go see specialists in Canada, and we didn't have to keep coming back to Boston. But my parents says, no, we're going to keep coming back. So my mom brought me to Boston, made those trips, the weekly, bi-weekly, monthly, 3 months, 6 months, all the way through. And I mean, I still go back to this day every year or two to see Dr. Walton, get my annual checkups, get my prescription adjusted. But I mean, my eyes have bounced back insanely well. I mean, with corrected vision, I mean, my right eye is 20/20, my left eye is 20/40, and I mean, I can play sports without my glasses on, and I can play golf, do everything, and just feel so incredibly fortunate that, I mean, again, my parents were such strong advocates for me through the process, continued to challenge when they knew something was wrong. And I know my mom went back to my family physician after all this process and said, listen, all I ask is that the next time a mother is this passionate and this mother is with the instincts, knows something's wrong, like, just please listen. That's all I ask. And yeah, that's what brings us to today.
Wow, what an incredible story. And your mom's definitely a champion when it comes to advocacy. And overall, I think that this highlights how important it is for clinicians and eye care doctors to listen.
Absolutely.
Yeah, well, I'm glad to hear that worked out. Now that you're an adult, what advice would you give to parents of children with glaucoma?
To my story, it's trust your instincts and continue to seek out what you feel is best, right? It's make sure that you read up on the options, attend things like the Patient Summit, see what's on the future, but also see what's available now. And I mean, continue to challenge the status quo. Like, make sure that you're getting the right advice that works for your child. And really, I mean, continue to be that champion.
Living with glaucoma is?
It's different. I mean, when I think about a lot of people can get a laser eye surgery and correct their vision without glasses, and a lot of people can wear contact lenses. But I mean, what the disease did, like, contacts aren't an option. It's always kind of funny because it's just different, right? It's a lot of people, when they usually have corrected lenses and they don't have an eye disease, it's a lot more normal, mainstream. I'm always kind of explaining that, no, I'm different. Luckily, my vision hasn't been impacted to the level that I see a lot throughout the patient environment. But yeah, just very fortunate.
Why is it important to find a cure for glaucoma?
I mean, this is a chronic illness that, I mean, sight is one of the most important senses that we have, right? It's so critical to our day-to-day that being able to treat that and prevent the progression of the disease, but also, I mean, it's such a chronic condition that weighs so heavily on society and a lot of people, that finding a cure is truly going to help and impact the quality of life so significantly that it couldn't be more important. And whether that's cures through earlier diagnosis or the therapeutics themselves, I mean, you see some of the amazing work coming out of, like, the AI and machine learning space of how do we impact rural communities. Like me, for example, I'm from New Brunswick, Canada. We don't have the infrastructure and the specialists or access to the specialists. How do we improve diagnosis in rural areas using technology such that we can prioritize and funnel them into specialists with that level of access? So some of these topics are so important. It's maybe not even it's a balance between finding the true cure and improving our diagnosis and our access to care.
Can you tell us how you first learned about Glaucoma Research Foundation?
Yeah, it's funny enough. So I had done some networking coming out of business school with a company in Toronto, Manon Research. And so they're doing a lot of therapeutics on again, a clinical trial candidate drug for treating glaucoma. And through that network, I got introduced to Richie, who's actually also on the steering committee. And hit it off with Richie. We had a great conversation. And sure enough, Richie was, I had asked him to help network more through the industry because this is such an area of passion of mine, just again, based on my history. And he ended up connecting me with Nancy. When a spot came up on the steering committee, he said, listen, this aligns with your passion. I need to introduce you to Nancy. And I said, absolutely, let's set up the call. She's actually an alumni of Western University in Canada as well. So again, we hit it off on the Canadian card, and no, the rest is history.
That's such a great story. In your opinion, why are events like the Patient Summit important?
It's so important because not only does it educate and provide questions and answers, but it provides a community, right? This is a patient community attending this event that you can talk amongst yourselves and gain insights about best practices, how everybody's coping. It's in a way, it's very supportive, on top of just being aware of the new directions and that hope and optimism of a cure on the horizon and some of what we're doing with the funded research. So I think it's just so important from so many ways to be able to attend these kinds of events and to be able to be a part of it.
Thank you so much for your time, Ben.
Thanks for
been
having
amazing.
me. No, it's awesome to be here.